So the other day, I was asked the question, what are some of the wildest things that I've seen in the psychiatric hospital working in one? And I thought about it for a second, and I told the person I was talking to, and then I thought, why don't I make a video about it? Because working working in psychiatric hospitals are some of the most chaotic, wild experiences you will ever go through, and anyone who's worked in them, you know exactly what I'm talking about with that. So first, I'll just start with this. If you've ever worked in a psychiatric hospital, you know this all too well. From the second you go into report in the morning, if you're an RN or you're a PCA, you know that when you walk in, every day is different. You might be walking into, after getting reported during report, a patient who is pissed on the wall, who's crapped on the wall, who has literally run through drywall, which I'll get into that in a minute. That's probably one of the most crazy experiences I've ever witnessed. And it's not only happened once, it's happened twice, which is kind of crazy in itself as well, which I'll talk about what the cause was of both of these. These were different patients as well, but it was from the same substance, which is crazy. That's why I make videos on this substance and why I think it's probably one of the most dangerous substances out there. So yeah, if you've worked in a psych hospital, you know this all too well. But anyway, there's so many, but I'll just go ahead and start in this one. So this happened two separate places, same drug they were using, and it has to do with PCP. So essentially, and this is why I think PCP is so dangerous, because when you use it, it's a hallucinogenic, but also it has that PCP has that K2-esque as well, which is that it has that psychosis going on with it, that extreme delusional paranoia. You're seeing things. You're going to be aggressive. You're going to have sometimes those grandiose feelings of, I'm on top of the world. I'm on some mission. And if anyone gets in my way, I will literally kill you. That kind of vibe with it. But yeah, PCP. So working through a shift, and later in the shift, randomly the patient just decides to start running through the wall. One of them ran through the wall naked. The other one didn't, but the factor was they had a history of smoking PCP, and the crazy thing is with weed. So it's that embalming fluid they put on weed sometimes to give it that enhanced effect, that more intense feeling, and they came in. The crazy thing about it was a day. It wasn't like they had just used it. This was 24 hours after it, and they were in an acute bout of psychosis, because sometimes when you use these, you expect the high to be a couple hours, but sometimes if you have that psychotic break, which can accompany it, which there can be a short-term psychotic break or it can be more of a long-term, that paranoia and aggressiveness makes you very dangerous. And in both occasions, everything seemed okay. The first patient, very quiet, I remember I did their assessment because I was there the first day, did their assessment. It was the following day, and they were just quiet, kind of out of it. We knew they were on something, couldn't get a urine test on them. Knew something was kind of off, but they just kind of secluded, right? So the next day I come in, and they're okay, offer them their medications. They cheek a medication. They didn't actually take it, we find out. And as the day goes on, they're just still secluding, won't really leave their room. And I'll never forget, right before they went to dinner, because they go to the cafeteria, patient comes out of their room, doesn't say a word, and just starts headbutting the wall. And this is drywall, right? So you have two sides of the unit, and you got a wall running down the center of the unit, and it's a drywall. And the patient literally headbutts, goes through it, and just starts ripping the drywall out. And I mean ripping it to where you could just step through to the other side of the unit. And thank God no one was hurt in that situation. But yeah, he did that. Got a shot ready for him. I think we had to give him more than a B-52, Benadryl, Haldol, and Ativan, but we also had to give him, I think they had to give him some Thorazine as well. But Getting him that shot was tough. He ended up taking it, but the thing was, it could have been a lot worse if there would have potentially been anyone when he first started ripping through the wall. It could have been a lot worse if you had somebody there trying to stop him. So my whole point of this is sometimes if they start ripping through the wall and nobody's being hurt and they seem to be okay, the worst thing you can do is try to stop them while they're in that grandiose, when they're in that grandiose thinking. Now, obviously, if they're a threat to themselves or someone else, you'd have to step in. But once he had made it through that wall, literally ripped the wall out, he calmed down. And he kind of he didn't snap out of it, but he kind of calmed down. That was his mission. He thought there was a demon in the wall. But yeah, I mean, the thing is, now picture if that was another patient he thought had a demon. That's where you get these things like, and I know there was that case in Florida of that kid who literally ate people's faces off, which it was not bath salts, but you know, when you have a psychotic break accompanied by drug use, these are things that are very real that can happen. So that was a very crazy experience. The other one was a patient who came in actively high, came up to the nursing station, dropped their pants, took off their shirt because they were feeling hot, jumped over the nursing station, ran around butt naked, ran into the wall, went down to the ground. Couple of the PCAs tried to help the patient up, didn't want help, ran to the wall again, wouldn't stop. And there's this thing, if you've ever seen somebody high on PCP and they're aggressive, they have this strength. It's like this incredible Hulk strength. It's like 20 times what your normal strength would be. And eventually starts elbowing the wall and he breaks through it. And then he just stops and he just sits down. And the reason why he did that, it wasn't a demon. This time it was, he thought there was an angelic being in the wall. So there's some interesting correlations sometimes with people who are that use like PCP in general, and when they're in psychosis where they have that mission where they're trying to go straight through the wall, for example. But once they've completed it, they sometimes will snap out briefly. But once again, if that's happening and no one's hurt, sometimes you just got to let them finish it. Now, if they're hurting themselves in the process, that's one thing, but I'm just being quite honest with you on this. Sometimes the best thing, let them finish it. They'll kind of snap out a little bit. You give them some medication, let them sleep. Because one of the biggest problems is a lot of these people haven't slept in days. Same with somebody going through meth withdrawal as well. Or meth-induced psychosis, crack psychosis, maybe cocaine, not near as much. It's just so expensive. A lot of times people aren't coming in to the psych hospital when they're in, like, when they've used cocaine and they have psychosis with it. It's a lot of times meth, crack, PCP. They haven't slept in days. So the key is getting them sleep to hopefully help. But there's a lot of times when they wake up where they're still going to be in those psychotic states in general. But yeah, that was one of the craziest ones. Another experience that I thought was pretty wild was one time right before one of the shifts ended, I'll never forget, a patient just started violently punching themselves in the face. And then I go over to the patient and be like, hey, what's going on? Because they had a history of not self-harm and wanting to actually kill themselves, but more so like just hitting themselves where they knocked their tooth out. And I'm like, why'd you do that? And then they just snapped out of it and they're like, oh, I don't know. Thank you, though. That probably wasn't a good idea. I'm sorry. And it was crazy because they would just violently start hitting themselves, punching themselves in the face, knocked a tooth out, and then you go over to them and be like, hey, what's going on? Let's stop, right? Let's calm down. And they would literally snap out and they'd be like, that's a good idea. I'm just a little frustrated. And you're just like, whoa. Meaning, if you just saw them day to day, these people, some of these patients at least, so, you know, in the psych hospital, at least some of them, you wouldn't even think anything of it. No problems. And then they'll randomly go into just like, once again, not saying like trying to self-harm, but just start hitting themselves and whatnot. And then you go up and you're like, hey, what's going on? And then, oh, I just had a hard day. And then they just stop and then they'd go watch TV in the day room or something. So they'd snap in and out of it real quick. That's another thing that was wild. Knocked his tooth out. You'd expect if you go over there, like, you know, they wouldn't quit, you know, they just going over there and they weren't on anything. They just start hitting themselves. You'd expect, hey, stop. You'd think there'd be a little bit more to it, but they just go, oh, sorry. I was having a rough day. Snap out of it. Can I have some chips? You know, something like, I don't mean to laugh, but you're just like, whoa, stuff like that. It's common to an extent. where literally, I mean, one of them, it wasn't, they didn't say chips, but I think they were like hitting themselves, literally almost knocked their tooth out, go over. You're expecting there to be more of a situation. You're like, hey, stop. And they just kind of snap out. They're like, oh, I'm sorry. I'll stop. That's a good idea. Can I have a cookie though? You know, but those a lot of times are the patients you have to watch the most. I'll just give you a little side note. If you ever go work in a psych hospital, whatever the role is, the patients who you should watch out for the most, obviously you should be monitoring all of them, obviously, but it's the quiet ones. The ones who constantly act out saying things like, I'm going to hurt myself. A lot of times, a lot of times they're just borderline. They want attention at home. They're not getting enough attention. And that's what a lot of it is. And I'm not hating. There's no hating on that or anything. You should obviously be kind. I always would be, for example, always try to give them some attention, because a lot of times they just want somebody to talk to. That's 90% of the time that's what they want. But the ones you have to watch out for are the ones who you read their history and they, have multiple SI attempts, violent behaviors, and they come in just very quiet, just, oh, I'm fine, and then they act real quick. Those are the patients you have to watch out for. But yeah, I just thought I'd do that video real quick. I got asked that, and there's just so many different stories I could talk about, which I'll do more in the future about. But it's like it's just never ending, from getting bit to getting spit on, and I'll do more stories on that in the future. I know I haven't done a lot of them recently, but I'll get back into that a little bit. But yeah, I'll do that too. I haven't been doing a lot of videos recently. There's just a lot going on in life. And we're all human, I've got my own problems that I'm working through, but all is good. Hopefully, just trying to push forward, do the right thing, and be a better person. We all mess up at some point in life, which, I definitely have as well. But I'm just thankful and blessed that, I'm healthy, and, hopefully things start going on the right track. Because, I'll just say this, even in the past, year and a half, I've went through some stuff that was my own doing, that I've messed up in, that I'm going to talk about in a future video. I don't feel quite comfortable talking about it yet, some of the situations that have happened, but I plan on doing it in the future at some point, because it's still very sensitive to me, and it still has there's still ramifications on it to where I have to work through it myself, because I'll just be honest, working in the healthcare setting in general, it's hard, and you have to really make time for yourself outside of work, and you have to really take care of your own mental health. It's the number one priority. You got to learn to balance work and balance your home life, and that's one thing I neglected for a very long time. I'm just going to go ahead and say that. But off that tangent, we'll have videos out. But yeah, I'm going to keep putting stuff out. I love you all. I love all of you in the comments. I don't care if you make negative comments toward me. It is what it is. It's the internet. I love you all, and I know if you do make a negative comment, you're probably going through something yourself, because I would do the same thing in the comments in the past. But it's the internet as well. But I love you all. Just hang in there, whatever you're going through. We'll do more videos on drug withdrawals as well. We'll talk about 7-OH. We'll do personal stuff. I'm going to do more shorts as well, which I've been doing. If you can't tell, check out all my shorts I do. It's just motivation, biblical motivation, you name it, because you have to have outlets in this life that create a sturdy foundation for yourself. Have a great week coming up. I love you all. Once again, I appreciate all the comments. Like and subscribe to the channel if you want. I don't like pushing it too much, the whole subscribe thing, because if you want to subscribe, I greatly appreciate it. If you don't, it's cool too. Love you all.